Insights. The conversation continues, but first, the fight against malaria has received a boost with the World Health Organization approving the use of a second malaria vaccine for use in malaria endemic regions. The vaccine, to be used in children under the age of 3, is expected to be a game changer in the management of the malaria burden, the disease that kills a child in Africa every minute. And as Brenda Wanga reports, Kenya has a place of pride in the deployment or the development of the vaccine, as some of the trials took place in Kilifi County.
The green light from the World Health Organization for the use of a second malaria vaccine adds to the globe's anti-malarial arsenal as the world seeks to reduce the impact of the deadly disease.
And safe and effective vaccines are also giving us new hope of bringing one of the oldest diseases known to humanity under control, malaria.
The vaccine R21 Matrix M is said to be administered in children between the ages of 5 months and 3 years in what is seen as a game changer in the fight against malaria. The second vaccine is as a result of researchers' efforts to improve the current tools used to manage malaria caused by Plasmodium falciparum parasite transmitted through mosquito bites. Kenya played a lead role in the third phase of the trials for the vaccine that were held in Kenya, Burkina Faso, Tanzania and Mali. A total of 4,800 children aged between 5 months and 3 years were enrolled for the trials that proved that the R21 was effective. The researchers, led by Professor Mainga Hamaluba, found the vaccine to be 75% effective.
The trials showed the vaccine to be safe, and safety monitoring will continue as the vaccine is rolled out.
Professor Mainga hails the success of the research and the adoption of the vaccine as a major milestone and the product of long-standing commitment and collaboration to control malaria. The second vaccine will be administered in 3 doses, one less than the recommended dosage of 4 for the first vaccine. Already, the uptake of the first vaccine in Africa has been encouraging, with close to 1.7 million doses administered across 3 countries. In Kenya, 400,000 children have received at least the first of the 4 doses. Malaria continues to be a burden for many African countries across the globe, with Africa bearing the brunt of this burden. Last year alone, 600,000 deaths from malaria were recorded globally. Africa accounted for 95% of the overall disease burden and 96% of the deaths recorded. The R21 vaccine works in the same manner as the RTS, but can be used at a much lower dosage and can be manufactured at a very large scale and lower cost per dose. The world's largest vaccine manufacturer by doses, the Serum Institute of India, is already lined up to make more than 100 million doses a year and plans to escalate up to 200 million a year. However, medical practitioners say the vaccine should not be seen as an alternative to the traditional approaches of combating malaria, including the use of insecticide-treated bed nets, indoor residual spraying, preventive treatment for pregnant women, and effective malaria medications. Brenda Wanga, Citizen TV.
95 students of Iregi Girls High School in Kakamega County have been admitted across various hospitals in the county after exhibiting symptoms of a mysterious disease that left them with slight paralysis on their legs. According to